Welcome to ETMC TV and this informative presentation by Dr. Dennis Deviney, board-certified and fellowship-trained orthopedic surgeon at the ETMC Orthopedic Institute. Dr. Deviney will discuss shoulder replacement surgery. Thank you for choosing ETMC TV.
When you look at a shoulder, here's the ball, also known as the humeral head. Here's the socket, also known as the glenoid. There are 4 tendons that make up your rotator cuff. One in front, one on top, 2 tendons in the back. There's also the biceps tendon, which runs in front of your shoulder. Now, a shoulder replacement and the rotator cuff tendons are removed from this model. On a shoulder replacement, we replace the ball because the ball is often flattened with shoulder arthritis. So this is a round metal ball, often has a stem that comes down the canal. On the socket, this is a piece of plastic here, and we cement that in. Okay, so instead of rubbing bad bone on bad bone, you're rubbing metal on plastic. A candidate for a shoulder replacement is a patient with moderate to advanced arthritis with functionally disabling pain. You fail conservative treatment and you have realistic expectations. Patients will complain of pain, loss of motion. They can complain of a popping sensation. They can often say, well, I can't sleep. I can't get in that comfortable position. The average age for a conventional shoulder replacement is approximately 55 years old. For rheumatoid patients, which is the most common inflammatory arthritis, the average age is approximately 50 years old. Well, there are anti-inflammatories, okay, both pills and creams. Cortisone injections have been shown to be effective in shoulder arthritis, and those injections can be done every 4 months. Gentle physical therapy, not aggressive physical therapy. Aggressive physical therapy can actually hurt the patients because you have a mechanical problem. That ball is not round on spots of it, so if you try to do too much, it's going to cause the patient's pain. Aquatic therapy is often helpful. If you fail the conservative treatment, then we talk about your next option. Whether it's a simpler procedure such as shoulder arthroscopy, which is small little incisions go in and clean up the joint. That's generally for mild to moderate arthritis. For moderate to advanced arthritis, then we talk more about arthroplasty. Now this is called a reverse shoulder replacement, and this plastic part is your shoulder blade. Well, the rotator cuff is gone, so it can't help you lift your arm up. A reverse shoulder replacement, we reverse it. We put the ball in the socket on the ball. You still have a muscle which is sitting underneath the skin here, which I'm demonstrating with my hand, called the deltoid muscle. And we use that to help lift your arm up and down. If we decide that you need a total shoulder arthroplasty or even a reverse shoulder arthroplasty, the average stay in the hospital is 1 to 2 days. I will start physical therapy the day after surgery. You generally go home. I'll send a therapist out to your house to work with you 3 days a week. And then when you see me in the office, I'll convert you to outpatient physical therapy. Well, we start what's called passive motion. The therapist lifts your arm. That's the first 3 weeks. Second 3 weeks is called active assistive. You use the other arm with a cane, golf club, pulley. At 6 weeks, I let you start using it. With a conventional shoulder replacement or a reverse shoulder replacement, golfing is fine, fishing is fine. I caution them about lifting heavy things, 50-pound bags of feed. I don't want them out there swinging a sledgehammer. This is for quality of life. If you've had pain in your shoulder, it's affecting your lifestyle. You can't do the things that you want to do. I think it's probably time to get an evaluation. Doesn't mean you need surgery, but you can have it evaluated. And you can talk to the patient about their options. I would call the main number, 903-596-3844, and they will lead you in the right direction. They will tell you if you need a referral or not, or we can just make an appointment and you can be seen in the office.
Dr. Dennis Deviney is a board-certified and fellowship-trained orthopedic surgeon at the ETMC Orthopedic Institute.
Well, I grew up in Illinois. I came down to Texas, went to college down here, finished up at Sam Houston State, Huntsville, Texas. I went to medical school at University of North Texas Health Science Center in Fort Worth. I did my residency in Detroit at Botsford General Hospital, and I did 2 fellowships, one in orthopedic trauma and one in shoulder and elbow surgery in Tampa, Florida. We actually did more shoulder replacements than anybody in the country, so it was a very good shoulder fellowship. Since I've been here at East Texas Medical Center, I've done approximately 600 shoulder replacements, and that's including primaries and reverses.